welcome to Therapy Thursdays, where we bring the therapist to you. I am your host, Marcus Alexander Velasquez, and I'm so happy that you're here today. Even having a discussion with our guest today before the episode started, we just talked about how cool this show really is. And I say that humbly, even though I'm the host, to talk about how much I learn and grow from just this platform, this environment of wanting to learn, wanting to grow, wanting to be willing and open and honest about our weaknesses, our struggles, our ways that we can grow as humans. I want to cultivate an environment of honesty, of openness, of not being non-judgmental, and all of us on the same road of wanting to become the best version of ourselves. I've gone through years of therapy and I've grown tremendously. So the purpose of this platform is to share that information with other people, to entice others to want to sign up for formal therapy themselves, to show them that therapists are real people like this wonderful woman we have here on camera. So I'm really happy. I've been getting great feedback. So for everyone who's been tuning in, whether live or sending me messages afterwards, I appreciate you guys tuning in. More than just tuning in, please take advantage of this information. Please apply it to your life. There's a difference of theory and practice. Theory is great, but if we can't make it practical, then it really doesn't matter. So we can talk about technical terms and technical ways to do all these things, but if we're not putting them to practical use, then it really just doesn't matter. So the purpose of the show, or at least one of the purposes, is to put these topics to practical use. And I want to take these somewhat foreign, big topics that people hear about but don't know much about and break them down as simply as possible into regular everyday terms and terminology so that we can all put this into practice. So I'm very happy and proud to be the host. So I'm glad all you guys are here. I'm going to start off with my disclaimer as always. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. So today's topic is one that I'm sure every single human being on the face of this planet is familiar with. Today's topic is worry. And we can go pretty deep with that. I'm hoping we are going to go pretty deep with that, but I know everyone here has experienced worry in one way or another, so I want to dive into that and, of course, talk about practical ways of accepting it, understanding it, healing it, and more. So today's topic is worry, and today's guest therapist is the wonderful Melanie Sivley. So Melanie, thank you so much for being on the show.
Hi.
Welcome. So Melanie, if you can give us kind of a little bit of your background, how long have you been in practice? How long have you been in practice, if there's any specific areas that you focus on? And then also, what drew you to being a therapist in the first place?
I love that question. Okay, so right now I'm in Central Illinois, Champaign, Illinois, and I've been in private practice for over 10 years now, which is just crazy to think of.
Awesome.
And my specialties, I started out mostly working with anxiety and depression and cognitive behavioral therapy, which is a pretty basic thing. And since then, I've been drawn to, I specialize now in working with complex trauma and dissociation. I don't know if you even have EMDR as a subject, but if not, then I
do. I love EMDR. Yes.
Yes, because that's my heart and soul. So I am an EMDR therapist first and foremost. And it's,
awesome.
We won't get off topic on that. I lost my little notes.
For those who are wondering what EMDR is, we have another episode where we'll get deep into that.
And then if you want to have any more, I'll come talk about it too, because So, basically it's complex trauma and PTSD kind of stuff, the stuff where you grow up with difficulties and dissociation. And EMDR. So that's what I'm drawn to do. Is for why I became a therapist. I mean, I think if I'll speak for myself, but Jung talks about that wounded healer, and so that's definitely me. I come from my own background of I'm going to try really hard not to cuss. I'm going to do my best, but I come from my own background of unique childhood experiences. That's a good way to put it. And through that, you know, I gained the empathy for people and wanting to help people and caretake, really. And then my own journey of, I don't know, pain and then recovery and healing, I guess. And then once, and I'm still doing my own journey by all means, I've got my own EMDR therapist, the whole 9 yards.
Nice.
But throughout that journey, it's kind of who I am. Like, I don't know how to say it. Being a therapist is just, it's just who I am. It's not a job. It's just me. If that makes sense.
I love that. That's beautiful. Yeah, that's owning your profession. It's not just a job to you. It's your calling. So I think that's great. You hit on a point that I often talk about, which is I always say that I believe everyone on the face of this earth should go to therapy, and I believe every therapist should have a therapist. So I love that you have one and that you admitted that to us. We're on episode 7 now. So our previous episodes, we've had our previous guest therapists talk about how they have gone through their own therapy or are currently going through their own therapy. And I love that because to me, again, it shows the humanity of this process.
Yeah.
Therapists are not superhumans. You're not a different breed. You didn't emerge from some factory. You are real people that have gone through your own things. And have healed, at least in a good portion, and want to share that with other people. And I think that's beautiful. So again, I will state that I am not a therapist. This is why we have our guests here, but I'm a huge proponent of therapy. So on the topic of worrying, Melanie, if you can let us know, if you can give us a formal definition of worry. And the reason I asked that at the beginning of every episode, because I want to make sure when we discuss terms that we're using them properly. So we've talked before about anxiety and depression, and those terms can be misused or inappropriately placed and labeled on people or situations. So I want to make sure we're using terminology correctly. So can you give us a formal definition of worry?
Sure. And, you know, I thought about this even before I signed up to talk about it. I thought about it a lot. And then, you know, being the hardcore therapist I am, I did my Googling research. And really, I mean, I found some like worry could be this, worry could be that, and a lot of wishy-washy stuff. But ultimately, at least as a therapist, clinically, like there is no mental health worry definition or clinical diagnosis. Really, it's more of a subset of anxiety. So anxiety, especially generalized anxiety, can be a really broad thing. And worry and that persistent rumination, the persistent thoughts that run circles over and over is part of that anxiety diagnosis. So it's a symptom of something that's usually much bigger in a clinical sense. In a more normal sense, like, again, we do all worry about, you know, whatever. I was worried about doing that. I mean, I was like, oh, why did I volunteer for this? So I was worried about it ahead of time. It was scary. See, I'm trying not to cuss. It was scary for me. So I worried about it. I thought, what if this goes wrong? What if that goes wrong? Why did I do this? Can I back out? So
you were worrying about your episode about worry.
Absolutely. Yeah. I mean, yeah, it was scary. It was vulnerable. So yeah. So worry is a very human emotion, right? And then in a bigger clinical context, it's part of a bigger diagnosis or part of a bigger definition of generalized anxiety.
Okay, good. And you brought up a good point, which actually leads into one of my questions. Is worry or worrying natural to being a human?
So you know, I don't know, I feel like some people might disagree with this, but I truly believe that all our emotions are God-given. And it doesn't matter if they're good or bad, uncomfortable or comfortable. So I think anger is a normal human emotion. I think worry is a human emotion. I think they all have their place and they all exist for a purpose. So absolutely worry is normal.
That's awesome. I would thoroughly agree with you on that. So since worry is natural, hopefully that helps some of our audience members beat themselves up at least a little less when they worry, because it is a normal, natural human emotion. So since it's natural, then there must be some benefits for it. So can you explain some of the benefits of worrying?
Yeah, and in some ways I might end up zooming out to just anxiety in general. But if we want to do little, then if you're trying to cross a busy street and there's a ton of cars and you're worried about, oh, I could get hit if I'm not careful. It
Mm.
keeps you, I'm like literally can keep you alive in that context.
Yeah.
And then if we take the bigger anxiety type of worry, the more constant all the time ruminations, I liked, because I definitely, I mean, I'm better now, but worry anxiety can be almost a superpower when it doesn't run the show. So back
Wow.
when I had jobs and I had an interview, I promise you, I would never be late for a job because I'm the person that would be so worried, so anxious about it. I'd make sure I drive by the place the day before to make sure I knew where it was. I'd check out to
Mm.
see if there's any traffic. I'd get there way too early and sit in my car for 10 minutes, but I would never miss a job interview. I got straight A's in school because I was like, oh, what if I don't do well? So I would over
Wow.
prepare. So in a lot of ways, it does definitely, it can, if it runs you, then it's problematic. But there's a lot of really awesome things. Is that weird to say? But there's a lot of awesome things about it too.
No, yeah, that's, I mean, if it is what it is, we don't shy away from the truth here on the show, whether it's uncomfortable or not. So if it's the truth, it's the truth. Yeah, that's great. I know that some of the benefits can seem like benefits. Oh, well, it helps me, like you said, get straight A's and all these other things, but not always do the ends justify the means. So, like, if you're stressed out, if you're pulling out your hair, if you're chewing on your nails, but I got straight A's, like, it depends on the individual. Is the ends worth the means for that person?
Well, it's do you use worry or do you use anxiety to your benefit, or does anxiety use you and run you? So it's really, is it manageable or is it out of your control? To me, that's the difference between them.
That's great. No, that's a great distinction. I appreciate that. And yeah, to reiterate that this episode, although it's titled worry and anxiety go hand in hand. So for those watching, if you hear us say anxiety more than worry, just know that the terms are pretty interchangeable. They actually work in tandem with one another, which is actually leading into one of my next questions, which what is the connection between worry and anxiety?
So yeah, and I really like that question because what I did was I went and refreshed my memory on what the formal criteria is to diagnose anxiety. And part of that is, and I've got it over here somewhere, it's I mean, worry comes in a lot of ways. So trouble concentrating or thinking about anything other than the present worry. And that's straight out of the DSM.
Mm,
So worrying or having that difficulty doing anything other than worrying is part of the criteria for anxiety. So they're like, not all worry is anxiety, but all anxiety will have a component of worrying.
nice. I like that. You mentioned something that I just want to make sure our audience understands. You mentioned the DSM. Can you please explain that for our audience?
Oh, so I don't even know. Is it horrible? Diagnostic statistics. I can't even say it. Manual. So it's like our Bible. So, and I want to be really careful talking about it. When we diagnose things, then we go through the DSM and they have very laid out specific criteria for it. I'm going to also say for me, it's a useful, I use the DSM, I use diagnosis as more to get paid by insurance than anything else. It's a nice set of tools to point in the direction of problems that people are struggling with, but I don't see it being like it's just a human tool. And so I don't know. Too many people go read it and say, "Oh my God, I have anxiety or I'm anxious because of this set of things," and then they define themselves by that, and that is problematic. But it's a useful way to look at stuff and to understand things.
For sure. Good. Yeah. You hit a good point, which I like is identifying with things. Our identity is huge. So we have to
Yes.
be careful with what labels we give ourselves because we could struggle with something, but it's not necessarily inherently our identity.
Yes.
Um, so like, and this is just my opinion, just my 2 cents, but I've been a part of some different like anonymous groups and there you go. See, awesome.
I love
So
it.
I actually personally, again, it's just personally, I actually had an issue with when we would go around the group and everybody would introduce themselves and I am, and then they would identify with
Yeah.
their issue. And I'm just like, to me, it should be a transitionary point in your life. You can admit that you struggle with this certain thing, but to identify with it is basically like never letting it go and making it define you. And I just didn't like that. So of course, I fell along with I went along with the structure of the program, but internally I was like, I don't identify with this title. I am who I am. I am Marcus. I am my own person. This just happens to be a struggle that's part of my path and my journey, but it's not who I am as an individual. And I think that's huge.
Yeah, and I honestly I agree, and it's so cute because I am too. Same thing. That's kind of cool.
Awesome.
So, but it's like I can say these things like I have a history of anxiety. I absolutely have a history of dissociation. I have blue eyes. I have gray hair. I wear. Do you know what I mean? Like they're all parts of me, but none of them are the full picture. And so,
Right.
struggling with whatevs is part of my identity, but it's not my whole identity. And other people, it's too easy to take that on, especially in a shame way, to make it their identity. And that just, it crushes me when people do that. And when therapists do it too. Sometimes it gets really easy to talk about my BPT, whatever, my this client or my that client. And then and every, like, it's just an easy thing to do. But then we reduce them to just a set of symptoms. And that's really doing a disservice to people.
Agreed. Yep. We are so much more than fill in the blank, whatever it is. Yeah. And it stinks too when you have people that are simply following directions. They're following the directions of the pros. They think, these people know what they're doing, so I'm just falling in line because they're the ones supposed to help me. And like I said, identifying with these things can hinder them and have them hold on to an issue probably much longer than they really need to. So that was just my 2 cents. We talked about some of the benefits of worrying. By the way, before I get to the next question, for those watching the second half of this show, roughly the last half an hour, we opened up for a Q&A session. So any comments or questions you guys have, whether it's about worrying, anxiety, or anything therapy related or mental health related, please type them in the comments. And Melanie and myself, mostly Melanie, will do our best to answer your questions to the best of our ability. So if you have questions, you can type them now. I already saw some questions were entered into the chat, so please keep them coming. We will start answering them around 7:30. So Melanie, we talked about the benefits of worrying. Can you let us know a little bit about the negative side effects of worry?
Yes, and they definitely exist. And I'll talk about the science. I understand the science part like I'm 5 years old. So when I explain it that way, that's about me and not about anybody else.
Not a problem.
With worry and with anxiety in general, it can do a lot of things. One is you can start avoiding. So if you are worried about, we could, in some ways, I don't even know, I was going to bring in the pandemic, but that's just too much. But if you're worried about what people are thinking about you, like with social anxiety, so you're like, oh, if I go to this party, people are going to think this, that, and then you stop going to parties and then you start isolating. So that's when worry can control you, right? Like literally you start making your decisions based on what your fear, what your worry is saying versus what's actually healthy or useful for you. Anytime we don't go try something new because we're worried, then worry is controlling us. And that's one we all do, but it's still a thing. The other thing is with sustained anxiety again, and this is the bigger general anxiety, our stress levels, our cortisol levels always stay high. So if we're in fight or flight, then our body is basically always saying there's a grizzly bear attacking us. And it is so unhealthy for us physically. So it's the cortisol, it's the stress levels, it's the high blood pressure, all the things that just mess up your system. So physically, and it's exhausting too. If your body's running around always in a state of there's a grizzly bear that's getting ready to attack, it's just so exhausting. So it wears on us and it tears us down. Yeah.
Are you familiar with the term energy? Wow. So I found that term and like it helped me a lot because what you're describing, I've lived for the majority of my life. I've always had, so energy is basically the opposite of energy. And it's just kind of living in like a constantly tired state. And it makes sense because it's not that we don't have energy. It's that almost all of our energy is going towards, like you said, the grizzly bear, towards worrying about what's going to pop out of every corner, worrying about if if this conversation is going to go sideways, worrying about any kind of confrontation, it is exhausting. And
Yes.
then it can get worse when you're exhausted, you're aware of it, and then you can't control it. So you start almost, and it's for some people, I can only speak on my own behalf, but at least for me, there's times where I would get mad at myself. I'd get upset. Like, why do I do this? Why is my brain fighting against me?
Yeah.
And that's where therapy, helped me to understand these things, to get to the root cause of certain things and relieve certain symptoms. So if anybody else is going through that, please know you're not alone, and please know that there definitely are solutions available for you. So if anyone here is wondering, Melanie, that if they're wondering that they may be a person who is a worrier, worrier, that's interesting. Worrier and warrior, they're really close. So what are the symptoms of a person who struggles with worry? So that if somebody's on the fence watching this and wonders if it's an issue, or they're like, everybody worries, it's no thing. Like, are there certain signs that a person struggles with worry to a point where it's unhealthy?
Yeah. And so I think, I think of a lot of things like this, like and this is a little loosey goosey, but does it interfere with your life? Does it mess with your relationships? Do people tell you all the time you worry too much? Or do you find yourself trying to control everything in your life to minimize? That's a big thing. Like, a lot of times people with they're super overly controlling. It's because they're so anxious that they're like, but if I can only make everything go exactly right, then I'll feel safe. Then I won't have to worry. But it never works. It's just your brain messing with you. You just keep trying and trying to control everything to minimize your worry, your anxiety, and yet it's never enough, basically. So
Yeah.
I think those are if you can't stop thinking about it, if it's causing you physical distress, if you're not sleeping, if people are commenting on it, if you're unhappy, then just go.
Mm.
Like, I hear all the time from clients, they're like, well, I didn't think my problem was big enough, so I didn't want to bother you with it. I'm like, you know what? If you're unhappy, then come get help. And honestly, anxiety, worry is one of the easier things to treat. Like, it's so effective, like CBT and all these other basic therapy skills. It's so easy to treat. And most of us like working with people that struggle with anxiety, because you guys are, and this is me too, but right, you're nice, you're polite, you're so worried about offending that your ideal clients. And so I have yet to meet somebody come into my office who was like, I didn't know if it was really a problem, where it wasn't a problem. Like, of course it is. If you think you need help, just go talk to somebody.
Mm. Yeah, no, that's great. Thank you so much for that. So actually, I have a question which falls in line with one of the questions that was submitted. So I'll actually ask it now. So my version of the question was, oh, now I need to find it. Oh, my version of the question was, how can someone tell if their worry becomes unmanageable? And the question that was submitted from one of our listeners was, how do you know when you are worrying too much and it is no longer normal? So they're pretty much the same question, just phrased different ways.
And again, I would say, like, does it make you unhappy? Does worry control your life, or do you control your worry? Because again, you want to be worried about crossing a busy street. Like, please don't ever, and we can't take that away from you. And I use a job interview, even though I don't, but if I had a job interview, I would want to be worried about it to the point that I made sure I was prepared, that I was on time. You saw how early did I sign in for this, right? Because I was worried about it. So I made sure I was there
Right.
well before you'd ask me to. So that's worry helping me and assisting me, versus I can't sleep, I can't eat, it makes me miserable. And
Mm,
that's all I can do is think about these things, worry about it constantly and not concentrate. And it causes me distress. So is it working for
yeah,
you, or are you working for it?
I love that. Yeah, I love the way you put that. I'm curious to know, are there events in one's life that can either initiate or even exacerbate worry?
I don't know about initiate, and that's interesting. Not to an unmanageable, I would think not to an unmanageable degree. I suspect, there's a big nature versus nurture. I tend to think it's mostly nurture. So I think we learn these things and we end up with these faulty core beliefs early in childhood. But then, of course, things can make it worse. And again, I think the pandemic is a great example. There are people
Yeah.
who are already anxious about all these things that have went into their house and have yet to come out. And my heart like breaks for them, because that's worry to the really severe part, right? So
Mm.
stress, big life events, finals, married, new job, coming on Instagram Live, all those things can, but anything super stressful will always, any mental health issues, a big stressor will cause it to pop up bigger.
Mm. Yeah, that makes a lot of sense. When I did some research on worry, I came across a really cool term. The term kind of describes and explains itself, but I want to just expound on it a little bit. And the term was the intolerance of uncertainty. And I thought that's really cool. So can you dive into a little bit about what the intolerance of uncertainty is and its connection to worry?
I cannot. I will tell you in some ways, because I saw that, I'm like, huh, I never, and I did some Googling. I was like, I bet I could BS through, but I don't want to be that person. So it's that I never heard that before. And I'm just going to be honest about that. To me, it speaks to that inflexibility in thinking. So if we have
Mm.
really rigid black and white thinking, and not a strong sense of empowerment or confidence, then I could see that taking place. Like I was nervous coming on, but ultimately I've done a ton of Facebook Lives. I'm like, it'll be fine. Like maybe I'll make a jerk of myself, but ultimately no big deal. Versus, oh my God, if this happens, it's the end of the world. I can, all those anxious thought spirals that go on. But no, I've never heard that term before. Sorry.
No problem. Well, I'm glad you made it on the Instagram Live today. We're happy that you're here. But yeah, from what I understood about the term intolerance of uncertainty, just it's to the point where clearly we all experience uncertainty to a point. We're never going to know everything. We cannot predict the future. So it's kind of like that acceptance portion that, I don't know what's going to happen and I'm okay with it, or I don't know what's going to happen and therefore it freaks me out 24/7. So I think that describes the intolerance of uncertainty for certain people, that they'll take that to the extreme and say, I don't know what's going to happen tomorrow. I don't know what's going to happen, like you said, at this interview, or I don't know what's going to happen in this conversation with someone, and freaking out about it, worrying about it, going down the rabbit trail of everything that could go wrong. And I say that from personal experience. Very interesting. So there are, again, I'm hesitant to say that there are good things that come from it, because for me, the ends don't always justify the means. So, I can say, oh, well, I often say I think of things that nobody else thinks of, because which kind of seems good on the surface. But everything that led up to that, of all the anxiety, the worry, the wasted time, wasted emotions, extra energy, so I don't have energy to put towards other things that I probably should be doing. Like, just me personally, it's not worth it after a while. Like, again, I understand the surface level benefits of it, of looking, oh, well, I get to think of things that nobody else thought. And I come across as an excellent problem solver because I can see all the possibilities for all the problems. So it can be great for, my corporate career, but not so great on my mental health.
Or when you recover to a degree, so that worry, anxiety no longer controls you, then you still have a superpower without all the negative effects of it. So if we can take away the pain, because I agree with you, right? I mean, obviously, anxiety it was my bread and butter for 5 or 6 years. That's all I worked with, and for good reason, right? So when it has that effect, then it's debilitating, literally. But when you can put to rest the worry that controls you and keep the good stuff, then it really does become a superpower.
Absolutely. Yes. And I would agree with that, because as my anxiety has been reduced, that superpower is still there. So now I'm able to use it
Yes,
to my benefit
exactly.
than to my detriment. Yeah.
Yeah.
And that was a long time coming. So I'm grateful for where I'm at, and I'm grateful for where I will be in the future, because current me will not be my future me, because my goal is to always get better and better. I
Absolutely.
look forward to. It's what is it? It's constant improvement, not perfection.
Progress, not perfection.
So that's right, absolutely. It is 7:30, so we are going to transition over to our time of Q&A. So if you guys have any questions on the topic of worry, anxiety, or anything else therapy and mental health related, now is your time to get your questions answered or any comments you may want to have. I'm going to go through our comments right now because we did have some questions that popped up. The first question was, let's see. Because we want you guys to take full advantage of our wonderful guests that we have on here. So someone commented that they're definitely a worrier. So again, I just personally, I would caution this person to be careful with the title. As opposed to saying you are a worrier, you can
Mm-hmm.
say that I struggle with worry. Because if you call yourself a certain title and identify with it, and it becomes your identity, then it's never really going to go away because you've made it a part of you. So even with your words and your verbiage of how you describe
Yeah.
certain things, be careful because words are programming to our mind. So to say I struggle with worry is a huge difference to your brain as opposed to saying I am a worrier. There's a big difference there. We have a question that says, what are good exercises or things you should do to help you relieve your worries or anxiety?
I love that question. So I'm going to give a Cliff Notes version of some of my favorites, and I hope this is okay. I'm going to say, but on our blog, I have so many because I was like, oh, what have I written about it already? There's a ton of
Yeah,
exercises on there too. Um, one of my favorite things to do with clients is we'll find the topic that's stressing that people are worrying about. And I like to use when I started private practice, I was like, I'm gonna fail. I'm gonna fail. This is never gonna work, whatever. So I'm gonna fail at private practice. And then on one side, I just like word vomited all my fears. And I was like, people are gonna come to me, decide I'm a ridiculous therapist, never coming back. And so and so is going to be embarrassed that he endorsed me as a therapist. And I mean, like in tears when I was writing this down because it
uh,
felt so real when it was running around in my head. So putting it down on paper already gave me some relief. And then so the fears on one side, the other side are challenges. And so I could look through and I could be like, people are going to come to me and decide I'm a ridiculous therapist. Well, I was already working in community mental health, and I would not just get one person, but I end up with their entire family because they loved working with me. So I could say,
well,
well, I know that's false because. And so I could go through, and the ones that I knew were false, I could challenge them and I could write out those challenges so I could see not just this formless fear that's running around in my head constantly just spitting little secrets at me, but I could see them. Half of them I could laugh at, and sometimes some of them are legit. Like maybe I don't know how to run a business. I could have very easily failed, right? So I'm going to fail. Well, maybe, but then I'm going to end up homeless in my car. Well, no, of course it's not going to get that bad. So listing the fears, understanding the truth in them and challenging them. And sometimes with my clients, when I start that, they really need help. They need help really nailing down what those fears are, and they need somebody to help point out where the lack of reality is and validate them and when parts of it are real. So that's one of my I love doing that with people. Another exercise I love is I call it the container exercise, and I have a whole script, and again it's on my blog somewhere, but the idea is that you gather everything up and you just put it in a container, put the lid on the container, put the container in an elevator, let the elevator go down, and then pull a curtain across it. And you just remove it, and you just remove it. When it's that baseless, nonstop running around circle, container it, container it, container it. Sometimes you might want to say, fine, I did this with somebody recently. He was nonstop ruminating and worrying. And so I gave him I didn't give him, we discussed it and we came to this agreement. He gave himself, I guess, 30 minutes, maybe an hour a day where he was allowed to just freak out and worry and be anxious and ruminate. But he had only that 1 hour, and the rest, and he said, this is when that time is. And the rest of the time when it came up, he containered it. So setting aside time to just give yourself permission to freak out, but only that time. And the rest of the time you have to put it away. Another one, this is an anonymous one, but I used to love, I'd have a God box, right? So I'd write down whatever it was that I was terrified of, fold it up, put it in my God box, turn it over. And then I would go like 6 months later, a year later, and I'd read, and half the time I'm like, what? I don't even know what I was talking. And that helped me
Wow.
understand how groundless some of them were, because a year later I did not even get the references. That was a favorite one early on.
Mm.
Um, Breathing exercises, right? The deep breathing exercises can physically slow you down, which can help you. Can help you. So sometimes with anxiety, right, our amygdala goes on, our prefrontal cortex, which is thinking, turns off. So if you can do deep breathing, I like teaching people 4, 7, 8 and count. So the deep breathing will slow your body down. And if you can focus on those numbers or do math in your head or whatever, that turns your prefrontal cortex back on and grounds you so that you can think. And that helps you put your worry away also. So grounding exercises are great for that.
Very cool. Those are awesome examples. Thank you so much for
Yeah.
that. The next question is very similar to the last one, but I'm going to ask it anyways just to see if it sparks a different answer in you.
Okay.
One of our viewers said, "Are there any tips or advice you can give on how to minimize extreme worrying or anxiety? I find myself having anxiety when my finances become low."
Mm. So I'd be I'd be careful with that one, because I'm trying to think how I want to say this. Most of my life, I did not make a living wage, right? It's only been in the last few years that I've been above poverty level. I mean, I got a master's degree and started out at 29,000 a year. So come on now.
Wow.
And I think in our culture, if we are not making enough money, then there's something shameful, there's something wrong about us. And so for
Mm,
me, I think if your finances are low and you're like, I remember this, right? You're like, how am I going to pay my electricity bill? Well, yes, I would be worried too. So I don't want to minimize, like, so there's ways maybe to manage it, but also I really want to validate that's something that's horrible, and it's not anybody's fault in I don't know, in the world we live in, unfortunately. Um, and so maybe giving yourself that chunk of time to worry about it, but also really validate. That's something to be scared of. If I don't know how I'm going to eat my next meal, or I don't know how I'm going to put gas in my car, those are real concerns. And so to be worried about that, I don't want somebody beating themselves up because they're freaking out, because I would be too.
awesome. Sweet. I hope that helped that person who asked that question.
Can I
We
give
do
you
have
one other thing for
absolutely go for it.
anxiety? I forgot. It's my favorite. Sometimes it is, sometimes it isn't. Right now it is. It's cardio. So 20 to 30 minutes and your target heart rate 2 to 3 times a week. And this is how I can't believe I forgot this, because it's truly my favorite thing right now. So if your body, if this is normal and you worry a lot, you're anxious a lot, so you're always up here going, there's a grizzly bear, there's a grizzly bear. If you work out, then it's like mimicking running away or fighting the grizzly bear. So you pop your body up a little higher as if you're reacting to the physical danger. And then
Wow.
when you're done with cardio and you drop down to a resting heart rate, your body and your brain are like, oh, I escaped, I lived, it's good. And it literally helps release all those stress hormones. Cardio is the best thing you can do for anxiety and depression and sleep.
Wow. That is the absolute best reason I've ever heard for working out. I love it. And that makes a lot of sense. Thank you so
Yeah.
much for that. Sweet. I'm going to start implementing that in my life. That's what I'm talking about. I learned so much stuff on the show. That's amazing. Sweet. We have one more question. Before I get to that question, again, this is our question and answer session. So, or section. So if anyone has any questions, comments, please type them in the chat. We'd be happy to share our knowledge with you and get your questions answered to the best of our ability. So please do not be shy. The next question is worrying oh no, if worrying is contagious, oh, is worrying contagious? Meaning if you are in a state of worry, can a person close to you worry even if they don't know why you are worrying?
Oh, that's interesting. So I'd say it depends on the person. Like I'm an empath, and I hate use because that sounds so woo woo, but I also absolutely pick up on people's emotions without realizing. Like if somebody's dissociating in session, I start getting all foggy and sleep. I know a lot, and sometimes if my clients get super anxious, I can feel it in my stomach. I had a
Mm,
job where I was doing great, and all of a sudden I became terrified that I was going to be fired. And one of my friends got fired at the end of the week. So if somebody is really sensitive to others' emotions, then they can pick up on that and not even know why, which is, ugh. the worst thing in the world. I still
Wow.
hate that. So yeah,
Wow.
that's, I mean, I think that's really possible.
Very cool. Melanie, you and I have a lot in common. I really like having you on because I consider myself an empath as well. There have been too many times that I can't even count where I've literally felt other people's emotions. I was in this, for one point, I was an assistant trainer for a leadership development company. And we got very intense in those classes. There was big time psychological point to it. And I remember we would have these activities. I won't go into detail what we did, but I remember I had to have been at least 20, 30 feet away from people. And I start crying.
Yes.
And I have no logical reason for crying, but I just felt the emotion in the room from that person. And I'm like bawling. And I
Mm-hmm.
literally could feel these people's pain. And
Mm-hmm.
like I thought it's amazing, but it's also for someone so logical like me and analytical, it's like, where is this coming from? But that's again, it can get out of control sometimes, but more often than not, that's a beautiful tool. Empathy is such an amazing thing, and I think it's undervalued, unfortunately.
I think it's, I didn't understand it myself for until just, I think, I don't know, to the last few years. So I think it can be really crazy making too. At least for me, it was because I'm like, why am I feeling all these? And then I started working, consulting with other therapists that are older and wiser than me. And they started talking about it. And I'm like, oh, wait, that's real. I'm not crazy. And it just felt so good to finally have that validated because I felt crazy for years because of it. I really did. Yeah.
Yeah, absolutely. The person who asked the question about ways to help, especially they commented about the money issue of being low on finances. I guess your answer helped them. They wrote back and they said, "Wow, these are such great tactics, and I agree. Working out makes me feel so much better once I've completed my routine. Thank you, thank you."
Oh, good.
Yes,
I
that's
love
awesome.
talking about anxiety. It's so easy to treat. Like it really is. So it's why it's one of my favorite things to work with because you get good results. People get
Yeah,
better.
absolutely. That's great. We actually have a comment from one of our previous guests, Melissa Finley, who I adore. I think she's amazing. She's been on twice and will be on many more times. But she said she wanted to share the free app called Insight Timer, a ton of great free meditations directed towards specific things like worry. Very cool. Thank you so much, Melissa, for that tip. She's really good with the apps, especially it's how much we're glued to our phones nowadays in society. It's great to find useful apps, not just apps that waste our time.
There's one called Wobot, WOEBOT, and it's a
Oh,
cognitive behavioral, like little robot thingy. And so it's programmed to help you with the exercise with the fears and the challenges. It's really programmed to help you. I forgot all about it. I haven't played with it in forever. It's super cute and it's free and it's really good. That's one of my, I forgot about that. Thank you.
sweet.
Yeah.
Wobot, WOEBOT, you said, right?
Yeah. Yeah.
Awesome. Very cool. Again, if anyone has any questions or comments, please feel free to type them into the chat. We'd love to answer them. For now, I will keep our questions going. Just want to be aware of time. We got about 15 minutes left. So we always talk about therapy on the show. Obviously, it's called Therapy Thursdays. So I always want to focus on the benefits of therapy because again, the term therapy is another misused term, and it having my experience with therapy, it kind of bothers me a little bit when people use the term inappropriately. So I'll give an example when someone says the gym is my therapy
Mm.
or XYZ is my therapy. I understand the sentiment. But the reality is those things such as the gym or whatever else people want to input in that sentence in that blank, it is a means of getting your emotions out, getting things off of your chest, getting energy out, whatever. That all feels great, but it doesn't actually lead to healing. It may help that what term am I looking for? Not session, but just that moment of energy, anxiety, emotions being up. So it helps in that moment, but it's not healing the core of where those things are even coming from. So I always want to make that distinction because for some people, they're like, oh, I don't need therapy because I do X, Y, Z, whatever. My next question is talking about that. How can a therapist help a person who deals with worry?
So there's a lot of it. It's easier. I think I'm going to use this as the example. Okay, so I'm a therapist. I've been a therapist for a long time. I did well before as a therapist. I did a lot of therapy on my own. And then as I started working more with complex, all the stuff that I'm working with now started bringing up layers of an onion, more stuff, right? So I started working with my own EMDR therapist. I'm a good therapist, like not to be, but I'm a good therapist. And I see things and I read people and I'm excellent at it. And yet when I go to my own therapist, she tells me stuff that should be so flippant obvious. And I'm like, what? I never realized that. Like it's, and then I have a second of feeling stupid. And I'm like, well, no, that's why I'm seeing her. So that alone is how therapists can help. I mean, if a good therapist needs somebody outside of her to show her herself, then I think we all do.
Agreed.
Yeah.
Agreed. Absolutely. Yeah, that's great. That's definitely one of the benefits of therapy is just to have not only another set of eyes and another perspective, but another trained perspective,
Yes.
another trained set of eyes to be able to see things in us that we may never have seen elsewhere. And again, some people are like, oh, but I don't go to therapy because I'll go to my best friend and talk. Well, with all due respect to your best friend, they're not a trained therapist. They haven't been around tens, dozens, hundreds of people to be able to pick up on
Yes.
certain behaviors or be trained on things that we don't even know about. Like you mentioned earlier, EMDR. The whole reason I went to a therapist is like, okay, these are supposed to be the pros. Clearly, they're supposed to know something that I don't know myself or I can't access through Google. So there has to be something they can teach me that I don't know about. So when my therapist introduced me to EMDR, I was like, thank you. This is what I'm talking about. These are the things that are not known by the general
Yes.
public and that we can go to the professionals and they'll be able to introduce things to us. So stuff like that, I love it. So yes, therapists are the pros. Please go to them. They studied this. Again, they're still human. They are still fallible. They can make mistakes. Still trust your gut when it comes to certain things.
Yes.
I was talk about my first therapist actually misdiagnosed me. He told me that I was bipolar, and that did not sit well with me. And I was like, okay, well, this guy's the pro, so he knows what he's talking about. But at the same time, I'm like, I don't feel bipolar. And it was interesting because
Mm.
that led me to go to my second therapist. And literally on our intake phone call, I told my second therapist, I was like, hey, my first therapist is telling me I'm bipolar. And he's like, Marcus, you're not bipolar. The guy's talked to me for 5 minutes. So I'm like, how do you know I'm not bipolar? He's like, Marcus, bipolar people know that they're bipolar. And I was
Mm.
like, well, look at that. So yeah, so it's just really interesting.
Yes.
Um, we have another question. I want to answer and honor these questions. The question says, do you happen to know if worrying or extreme anxiety can cause other medical symptoms? For example, I hear a lot of people complain of itchiness. Wow, interesting. Go for it.
Itchiness is new for me. So I, I think I think there's a lot to be learned yet, right? We're starting to know there's some connection between anxiety and inflammation and gut stuff and all of that. I think there's research also, and again, I'm so bad with, I wish I had the brain for it. I'm so bad with the science part. But we know that there's something about early childhood trauma, chronic stress, early complex trauma, and a lot of anxiety is from that early childhood stuff that, and it makes sense to me, like if you're at this point all the time of stress, anxiety, trauma, whatever, it breaks your body down. And so a lot
Mm,
of inflammatory disease and a lot of autoimmune diseases pretty much, and I think the science is coming in, but to me it feels stupid and obvious too, there's a huge link between inflammatory diseases and trauma and chronic stress, anxiety, all of that stuff.
wow.
Yeah, absolutely. So I don't know. Rashes are interesting, but I guess that could be an inflammatory thing, maybe. I don't know about that. That's a new one for me, but I wouldn't be surprised. It shows up, yeah, it absolutely. Like we used to say people are hypochondriacs. That's a load. What it is our bodies respond physically to the stress and the chemical imbalances and all this stuff that's going on. And they didn't know better, so they just called women hypochondriacs. But there's an absolute correlation between the two.
Very cool. I love that we're always I love that we're always learning, willing to be wrong, willing
Yeah.
to correct old ways of thinking that we thought were right at the time, but with new information should lead to new thinking. Like I think that's one of the best mindsets to have in life. Be firm in what you know, what you believe in, but always have an open mind, always be willing to be wrong, always be willing to learn, because if without those mindsets, you will hinder your own life and hinder your own way of going. You feel like, no, this is the way and there's no other way. Well, then there's no other way because you said there's no other way, but you're holding yourself off to the potential of there being more. So I would suggest for everyone watching to always keep an open mind, always be willing to be wrong, always be willing to challenge your beliefs and your perspectives, because it's a big world out there and we have a lot to learn.
Yes.
We have a couple comments. We have a comment. Someone said, I agree, therapists can hold up a mirror, which is a great comment. It is true. They will hold up a mirror. Awesome. Someone else said, oh, I have to leave this wonderful conversation, but want you to know these conversations are powerful. Thank you.
Mm.
Sweet. That makes me so happy. That's exactly why we put on this show. Let's see what else. Also, the same person who gave the last question has one more. They said, sorry to keep it going. You don't need to apologize. This is why we have the show. You mentioned autoimmune. So like thyroid diseases, can they be from anxiety and extreme worrisome?
So I don't know. And absolutely, I'm not, and I don't have the mind for a doctor. Usually, and I wouldn't say anxiety, or so it's not, because that feels really shaming. Like, oh, I worry so much and so I'm making myself sick. And I don't think that's the way it works. I think especially when we grow up in chaotic, traumatic households, and then from that comes born anxiety and all these other things that are part of trauma based, because most of the time I think everything ties into trauma. So that has a physical impact on our body. But usually I think of things like, I just got diagnosed with, it's like Moxnix, but it's like Sjogren's or something, I don't know, or fibromyalgia. A lot of those, I think there's a huge link between those and trauma slash anxiety. But that's not, you're not making yourself sick. It's just the way your brain was wired and the way your body was wired as a result of early childhood stuff. So, I mean, I just want to make sure, I don't want anybody to feel like, oh, I'm doing this to myself, because it's not. Like, it's not your fault.
Melanie, you're wonderful because we have very similar trains of thought, because I'm the same way too. I hate when people beat themselves up, especially
Yes.
for the wrong reasons. Like you talk about, like your therapist will point things out in you and you're like, of course, that's obvious, but you needed somebody else to say it. I do that with other people, and I will tell you the number one thing that I catch people most doing, and I point it out to them, is their self-talk.
Yes.
So once people says, I'm stupid, I'm dumb, I'm such an idiot for doing that, stop. No, you're not. You're not an idiot. You may have made a dumb choice, but that choice doesn't define you as a overall
Yes.
dumb person. But again, our words are powerful because they wire our brains. It is literally like programming. It's, what is it? NLP, neuro linguistic programming. So our words mean a lot. So be mindful of how you talk to yourself, because you're the only person that's with you 24/7. So if you can't treat yourself kindly, you can't expect others to.
Can I say something really fast about that, though? Is
Absolutely.
that words are powerful. And half of the beginning sessions with my clients is about reframing. And I'm like, they get so mad at me. I'm like, hold on. They're like, yeah, I know. And then eventually they start doing it. But the problem is that we don't just do that to ourselves. So I have a cartoon in my office, and it shows like an adult going, stupid, to the little boy. And the little boy's sitting there, and the thought bubble's like, stupid. So we learn those things either implicitly, or either it's said to us or it's implied to us. We learn those things from the people around us when we're little, and then we take on their
Mm,
voices as our own, and that can be
mm,
unlearned. So we don't just beat ourselves up because, oh, I just beat my, no, we get taught that when we're children, and we can be untaught that, and we can have a new voice that supplants that. Sorry, I
yeah.
feel passionate about
Awesome.
this.
No, 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 please. No, no apologies needed. Yeah, you mentioned one of my favorite words, which is unlearn, which is a very necessary thing to do in life. Everything that's in our heads is not benefiting us all the time. So there may have been things that we have learned from our parents, learned from people around us, learned from our childhood, or we have our own bad habits. But just because you're that way doesn't mean you have to stay that way. Just because you have a bad habit doesn't mean that habit needs to stay with you. So if you do have a bad habit of talking down to yourself, it is a habit, and habits can change. So please remember that. But yeah, the way you talk to yourself is huge. I've heard that too, that for parents to be wise about how they speak to their children, because that becomes their inner voice. So that's so true. And one thing I want to hit on too, that I've also seen a lot as well, is when people do that, either talking down about themselves or others, they will quickly cover it up by saying, "Oh, I'm just kidding. I'm just joking. Don't take it so seriously." Like, it's not a joke. These words really do mean things. And
Absolutely.
if you get to the point where you're like blocking everything that everybody says and not taking it personally, after a while, you can literally just make your heart hard and numb, and then nothing affects you. And then you just become very stoic, and that's no way to live life.
Yeah.
So just be mindful of how you talk to yourself and talk to others, and especially be mindful of what you believe, because a lot of our own ways of thinking are based on what somebody else told us, and we chose to believe them. Because just you can't control other people. So people can spew negative things at you all the time. It's what you choose to believe that becomes your narrative. So be mindful of what you believe.
I'm going to jump in really fast and say, if we're 2 years old or 4 years old, or if our culture says women should be sweet, or our culture says that you're less than because of the color of your skin, I don't know that those are choices. Like, if we get this given to us 24/7, especially when we're babies, but isn't it as
That's
adults,
fair.
we can't help but internalize it. So I wish
Yeah,
it was easy as I choose not to believe you, but I think it's much more powerful and insidious than that.
very true. I feel that. I accept that. Thank you for mentioning that. We have a couple of the comments. Someone said, "I've been going to therapy since last November, and I highly recommend it too. I've been going since November, and I've already noticed the changes in me."
Good.
Awesome. Very cool. Oh, she said, "I cannot wait. Looking forward to more changes in my life." Awesome. Good for you. We're happy you're here and learning. We do have another question. Do you think that symptoms of anxiety can show differently from adults to children? Are there different signs of anxiety for children/youth? And if so, how could I tell if my child suffers from worry or anxiety? Great question.
They're I know for depression, I have a few ideas of what it is. It's yeah, I mean, that is a great question. It absolutely shows up differently. I don't work with kids or adolescents anymore, so I am not the person that tell you. So find a professional that works with, and I think that's useful too. Like, there's some real training to work with kids. A lot of people say, "Oh, I work with fill in the blank," but unless you're, especially with, well, with anything, but if you're not trained outside of your master's degree, then maybe you don't. Yeah, so find somebody that is really trained and has taken the time to learn that specifically, because that's a specific thing. It's a great question. I don't know.
Very cool. And thank you for your humility. I appreciate that.
Yeah.
And that's a great point too, that therapists are pros, but they don't know everything. So that's why I asked about specialties, because a lot of therapists will specialize in one particular area of anxiety, depression, trauma, PTSD. So find a pro, but that specializes in your need or what you're looking for. So again, thank you for your humility, because if you don't know the answer, you don't know the answer, which is
Yeah.
fine, because that's not your focus. So that's great. We have another comment too. "Wow, this has been a great session. Thank you both for caring enough to share your professionalism with us." Very cool. Awesome. So happy to hear that. All right, well, it is 7:59, so we are going to wrap it up. I always want to remind you guys that, actually, I want to ask you, Melanie, are you accepting new clients?
I am not. I am beyond full. I
Oh.
do have two clinicians that work with me and a third that's coming on in the middle of May. They are accepting new clients, but I have a waiting list. So I love you guys, but please don't call me unless you want to talk to one of the others.
All right, that's good to know. But so the contact information that you put on the spreadsheet, are they able to reach the other therapists on your team through that?
Yeah, absolutely.
Perfect. So I want to remind you guys, if you want to have access to Melanie or any other of our guest therapists, please click the link in my bio. When you click that link, it will bring up several options. The third option down says Therapy Thursdays. When you click on that option, it will bring up an online spreadsheet. That online spreadsheet has all the contact information for all of our guest therapists. You'll get their name, the name of their practice, their phone numbers, emails, how much they charge for sessions, what areas they focus on. Do they do telehealth? Do they accept insurance? Everything you want to know about them is on there. So please utilize that information. What I love is when we have our guests on here, there may be something about that therapist, maybe the way they look, a comment they said, something that I just click with this person, then you have that opportunity to connect with these people. So please connect with them. Please utilize these resources. I'm going to finish up with our disclaimer. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. Melanie, it was an absolute pleasure having you on the show. Thank you so much for being here. Do you have any final comments for us?
Just again, on our website, on our blog, there is video after video with exercises, especially for anxiety, because I specialized in that for so many years. So go make use of it by all means. And thank you. This was a lot of fun in spite of my anxiety.
Awesome. Can you please let us know what your website is?
It is Bodhi, B-O-D-H-I. Wait, what is it? Bodhi Counseling. I don't know. It's on the, I can't think of it right now.
It's on the spreadsheet. It's on the spreadsheet. Go to the spreadsheet. Awesome. Well, Melanie, it was an absolute pleasure having you on the show. We'd love to have you back. So if there's any openings on our spreadsheet, I know we still have some on topics that you'd like to talk about, we'd love to have you back. If there are topics that you'd like to talk about that aren't listed, we're happy to add that to the list as well. So you have my contact information. Please feel free to reach out whenever you want. Thanks for being here.
I think I'm signed up for a couple more, so absolutely.
Sweet. So we'll see you again.
Okay.
Everyone else, thank you for being here. As always, we have Therapy Thursdays every single Thursday at 7 p.m. Central Standard Time. So we will be back next week. So thank you for joining, and we'll see you next week.
Work. Watch you do my